Hello, I am David Yelke. I'm a professor of economics at the University of North Carolina at Chapel Hill and a fellow of the Carolina Population Center. Half of the population of the world's low-income countries will soon live in cities. This makes programs that provide family planning and other reproductive health services to diverse urban populations increasingly important. The Urban Reproductive Health Initiative, as envisioned by the Gates Foundation, was to work in the urban areas of 4 countries: Senegal, Nigeria, Kenya, and India. Gates Foundation idea was that they would try to restart family planning programs in the urban areas of major cities with the idea that this increased interest in contraceptive use would spread out from them to the rural areas. So the almost complete focus in terms of the implementation on urban areas was fairly unique. One of the things that the Gates Foundation really understands is that monitoring and evaluation cannot be an afterthought for once a project is finished. That's where I and other monitoring evaluation experts come in. The Measurement, Learning, and Evaluation Project, which we refer to as the MLE project, is the independent evaluation of the Urban Reproductive Health Initiative. It is evaluating the success of programs that increase the demand for modern contraception, as well as interventions that enhance the quality and access of family planning services. The idea was that they would bring us in on the ground floor where we could design an evaluation of these programs prior to these programs even starting. So they gave us actually the first grant in the series of grants for the Urban Reproductive Health Initiative. We planned evaluations in these countries, collected baseline data in these countries. We were doing these surveys to try to measure program components of exactly what they're doing. Since the initiative is being implemented simultaneously in all 4 countries, MLE is able to provide feedback on program performance to each country and share information across countries. Changes in implementation plans in one country may be made based on what program components are more effective in that country, as well as information about activities that may be working in other countries. And then finally, it's evaluation, and that's to evaluate whether or not the programs actually work. What the Gates Foundation is interested in is which specific components of the program had the biggest effect and which were the most cost-effective components of the programs. Our approach to monitoring and evaluation involves the collection of both cross-sectional surveys and longitudinal surveys. The cross-sectional surveys provide city-level representative information on the attitudes and behaviors of a population at a given point in time. Since we will have cross-sectional surveys at the beginning and end of the project, we can measure the change in modern contraceptive use for representative samples at the beginning and end of the project. And with the longitudinal design, we're able to follow the same women through time, letting each woman act as their individual control and see how all the various program components interacted to cause her to change her behavior. This allows us to measure the independent effects of both demand and supply side interventions on modern contraceptive use. By using this hybrid approach, we can maximize the strengths of both types of data. For example, they could have a radio spot. We would measure whether or not the respondents heard the radio spot, i.e. we'd measure their exposure, and then we'd see whether or not that radio spot actually altered their behavior, like caused them to increase their contraceptive use. And we do this for a wide variety of programs that these implementers would be doing, and then we would be testing to see which programs were best and which were most cost-effective. Looking forward, rapid urbanization will continue to be the source of significant challenges in public health, but it is my hope that the work we have done with MLE will be an important resource for future reproductive health programs.